everyone. I am the newly elected city commissioner, Dan Ryan, and I'm just thrilled that I found out I had this assignment a few days ago. And I want to acknowledge Mayor Wheeler for his work with this group over the last 2 years. I really will get a lot of download from him and his office. And I'm really looking forward to working with all my colleagues on the Portland Children's Levy Allocation Committee. I should look at my script. I was given a script. I also want to just take a moment right now. Can we just acknowledge this moment in time? I mean, I'm not the only one that has a heavy heart because of our state burning up over the last 4 or 5 days. And then I'm also not the only one that had going on walks and getting fresh air as my own personal way to get some balance during COVID. And I know we have people that have talked about their health conditions today, and we want to acknowledge that as well. I mean, even the air inside is tough. So let's just know, I know I'm privileged. I'm in my kitchen right now, and that I can be inside and I am safe. And I know there's a lot of Oregonians and people on the West Coast that can't say that. So it's a real privilege and honor to be here today, especially under these conditions. But I just wanted to make sure we started off by acknowledging what so many people are going through right now. So let's see. I just also want to give a little bit of background about myself. I have been come through the nonprofit sector 30 years since I finished college in some various form of the nonprofit sector, whether it's education, pre-K to all the way to higher education at Portland State, and then also in health and human services, mostly infectious disease. And I've also have experience with youth and family services with the Big Brother, Big Sister program up in Seattle, and then finally in the arts. So I just wanted to let you know that my background is definitely from the nonprofit sector, which I realize are most of the partners, in fact, whom we work with. So it's I love this assignment because it's familiar to me, and I really wanted to just say thank you, Mayor Wheeler, for this assignment once again. I'm a really big advocate for the Children's Levy. I think we all know most Portlanders are. It's one of the easier things to put on the ballot, I think, with assurance that it just might pass. So kudos to Commissioner Saltzman for having the vision to get this up and running. And I also have been tracking the evolution of the Portland Children's Levy, especially your work of late, really leaning more and more into equity. And so I've just been rooting for you and supportive of the evolution of the fund. So thank you, Lisa, for your leadership and your staff. Since this is my first meeting, I just asked for some grace, and also I realize it's a shared responsibility. So I'm looking forward to working with you always with that in mind. We are a team. So with that, I'd like to welcome the people that I get to serve with. And most of you I know, some of you I know actually kind of well, but that doesn't matter. What matters is I introduce you right now. So let me introduce Multnomah County Commissioner Jessica Vega Peterson. Nice to see you. And County appointed Felicia Tripp Folsom. Hello, Felicia. And then we have City appointed member Tracy Rossi. I'm looking at the little squares right now. I'm sure all of you are doing that too. And then business leader, thank you for joining us for the beginning of the meeting. Mitch Horniker, I know that you can only be with us for about a half hour. There you are. So we appreciate you for being here. And with that, I also want to turn it over to Lisa Pellegrino to introduce the staff who's here today.
Sure, thank you, Dan. So I'm Lisa Pellegrino, as Dan said, the director, and I'll introduce Meg McElroy, who's the assistant director, and raise her hand. And Erica Bridgman-Bugnoli, who's the small grants manager, raising her hand. And Mary Gay Broderick, who's the communications and outreach director. And John Kelly, who's the fiscal and admin specialist. And finally, John Coughlin, who's the communications and outreach.
Right. Okay. So let's begin by, is that it? We can go over to
it. Nope.
All right. So all of you had a chance to look at the minutes from the last meeting. And if so, do we have a motion to approve?
I motion to approve the minutes.
Yes.
Second.
All right. So it's been moved and seconded. All those in favor?
Aye.
Aye.
All right. So moving on. Thank you. Up first is the small grants. We're going to hear from Erica, the small grants fund manager. You will review the process that's been going on thus far, including the step 1 and now we're heading into step 2. I think all of you had that in your packet and hopefully had a chance to look that over. And so we will have a chance, of course, to ask questions. And Erica, would you like us to ask as you go along, or would you prefer for us to try to hold off a little bit? I'm talking to myself right now. What's your preference?
Why don't we save it until the end in case my answer might be answered in the next slide that we just haven't gotten to.
All right. I will totally try to discipline myself to do that. Thank you very much. All
Okay,
right.
thank you.
All yours, Erica.
Okay, I'm going to share my screen here. Okay. So I'm going to begin with some background just really quickly about the Small Grants Fund to bring us all kind of onto the same page since we've had some changes in the allocation committee. The purpose of the Small Grants Fund is to increase equity by investing in programs of small organizations that are arising from marginalized communities. Although the Small Grants Fund itself arose out of 2 different community engagement processes, we aim to make the process of creating the fund for small organizations in and of itself to be a participatory process. So how we did that is we had community conversations in February and March that reached over 30 organizations, and they covered many different cultural groups, including African immigrant, Arabic speaking, Zomi refugee, Black, Indigenous, Pacific Islander, multicultural children and youth, and disability groups. After having these community conversations, PCL staff convened the ad hoc design team to advise and design the process. And then on April 24th, the allocation committee approved the step 1 forms and empowered the review team to decide who moves from step 1 to step 2. In just a second, I'm going to talk about how who was composed of the review team. And in step 1, the grant cycle was open from May 15th to July 8th, which allowed the small grants applicants about 7.5 weeks to complete their application, during which time we also had applicant information sessions, knowing that a lot of small organizations don't have experienced grant writers, or they may be writing in 2nd or 3rd languages, or just have less experience with grant preparation. So we wanted to have time for me to conduct applicant workshops to kind of help them go through that process. PCL received 31 applications, and the requests totaled over $4.4 million. We have $1 million that we are able to allocate in the end. The applications were reviewed by the design team. The design team is composed of people with experience in both public and private funding, small organizations and/or PCL processes, as well as lived experience as members of one or more marginalized community. Then, in addition to those 6 design team members, we recruited 6 members from the community. Those were recruited by design team members and PCL staff using criteria that came out of the community conversations. Most important among those criteria from the community conversations was that the reviewers who reviewed the applications have experience in small organizations, either as a participant, a volunteer, or someone who had worked there, and who understood kind of the growth mindset of small organizations and the way that they may be structured differently from the larger organizations. In the Small Grants Fund, we were defining small organizations as having a budget of under 1 million. Although they would need to have a minimum budget of 30,000 in order to apply for the fund. In addition So the applications moved from step 1 to step 2 based on score, but also based on additional criteria. The additional criteria included organizational type, such as culturally specific, culturally responsive, or intersectional, or disability-led organization. Staff and volunteer demographics, grant size, and program area. Of the 31 applications that we received, 12 were selected to move for step 2. The total 3-year request of the 12 applicants moving forward is 1.7 million, which means that in the step 2 process, we will have to narrow it down by an additional 750,000. 24 applicants proposed either mentoring or after-school programs. Those were by far the largest chunk. 9 applicants are moving forward in those categories. 2 of the 3 hunger relief applications were moving forward to step 2, and the remaining 4 applications were in other program areas. When the additional criteria was applied, the review team felt that it was very important to prioritize hunger relief, specifically because of the current situation of food instability in our community. So these are the names of the applicants who are moving to step 2. I'll read through their names. You can see in the 3rd column, you can see their scores and you can see their funding requests. So the smallest amount that they could request under the small grants fund is a different amount than the large grants fund. So the grants range from 10 to 60,000 per year. The funding request numbers here are all listed, are all 3-year totals. So even the smaller ones that you see, like at the top, that's 58,500. That's the total amount they would receive over the 3-year period. So the applicants are Brown Girl Rise, Elevate Oregon, Portland Tennis and Education, Camp Elso, Native Wellness Institute, Urban Nature Partners PDX, African Youth Community Organization, Black United Fund, Urban Gleaners, Grow Portland, Ethiopian and Eritrean Resource Cultural Center, and Alif Ba Arabic Education School. Finally, at the end of this is these are the process recommendations that I'm asking for your feedback and approval of the step 2 materials that we have submitted, and then your vote and approval of the step 2 process. The step 2, under these recommendations, the step 2 application would be due on October 2nd. And then the review team and the PCL staff will be conducting virtual interviews. We had wanted to have an interactive component and not have the entire process be a written process. We felt like that would be more equitable for some of the cultural groups who are more comfortable presenting their stories of their organizations orally. But because of the pandemic, it really only left us with one option, which is to do them virtually. We can do them audio and video, and we can also have interpretation if and when it's needed. The review team has agreed to meet on November 10th. At that time, we would look at the scores from both the interviews and the step 2 applications. And then the review team would make funding recommendations to the allocation committee. This is replacing what we would do in the large grant process where the staff makes recommendations. Instead, we are going to be getting recommendations from this community-based group. And the PCL staff will be facilitating that discussion. Then we'll submit those to the allocation committee for approval, and then on to city council, and then the grants would become effective on January 1st. So that's the end of my presentation. I can take any and all questions now. I'll stop. I'm not sure if I should stop sharing my screen while I do that.
Yeah, I think it'd be better just to maybe take it down and then bring it up if there's a specific question related to it. Yeah.
Okay, thank you.
So any questions? Mitch, I know you have to jump off soon, so why don't we start with you?
Hey, thanks. I really appreciate the information, the presentation. You know, one of our big concerns when we started this was trying to thread the needle between a streamlined process and the due diligence and infrastructure requirements that we just have to have because it's public money. Do you have a feel for how'd we do? Was it, do we need a course correction one way or the other? Or do you feel pretty good about how you ended up?
I think that we did do very well. There were, it's a pilot process. So there were things that we learned in the process. So for example, we had developed a scoring rubric. And one of the things was we had really wanted to allow for small organizations serving like small immigrant and refugee organizations, among other cultural groups, an opportunity to be able to access funds through this way. And we found that despite our best intentions, despite having immigrant and refugee members on the design team, that the scoring rubric still biased against those groups a little bit. And so we had to take that into consideration and discuss that once we realized that through looking at the scores, because we had 5 refugee organizations apply and 4 had ended up at the bottom. So we re-examined them and had to look at these additional criteria. So that was one course correction that we made, that we learned. Overall, I think that we're going to need some time to be able to go through the whole process and really pull out all of the themes and lessons learned from it. But it has been very participatory, very driven through a lot of feedback from people who will be most affected by this. And I do think very strong organizations are emerging through the process.
My other colleagues, questions? Tracy, Jessica, Felicia?
Erica, how was the review committee selected that comes before our process?
So the review committee was the design team members, which you all approved in previous meetings. And then from the community conversations, the community participants said there are certain things that we would really like you to consider when you're recruiting reviewers. We would like people who have an understanding of a growth mindset, how there are ways that smaller organizations are structured differently and have less capacity than larger organizations. We want people that have some understanding of that. We would like to have people who are a reflection of the community in terms of diversity and lived experience. We want them to have expertise in our program areas, specifically in those program areas. And to have participated in programs in those program areas in small organizations, either as, from a work perspective or a volunteer perspective, or having been a participant going through a similar program. So we took those criteria and then recruited people from the community who had those based on recommendations from design team members or PCL staff.
Thank you.
Other questions?
I had a question. So it looks like the step 2 applications are in process right now. Do you have the timing right?
So step 1 is complete. Then you all, if you approve the application today, then I'm going to send those materials out to the step 2 applicants.
And so I guess to piggyback on Mitch's question, were there any changes to the step 2 design based on some of the feedback from and some of the outcomes from the step 1 application? And then, just looking at how you said that the immigrant and refugee, organizations tended to score.
So the step 2 process has 2 parts. It has the interviews and it has the application itself. One thing that we didn't put in these step 1 applications really was anything about COVID or the pandemic. And that was just because of the timing of when the pandemic happened and the materials came out. So how people were planning on adjusting their programs to be able to be COVID safe and also still relationship based and engaging was a big part of what we put into step 2 as a reflection of that. And then step 2 is also a lot more logistical. So step 1 was more, tell us about your organization, tell us about your program, tell us about the ways that you would accommodate people with disabilities, or if you're a disability program, how you accommodate participants with disabilities who are Black, Indigenous, people of color. Step 2 is, now we really need you to go into deep detail about the budget, how you're going to use the money, how you're going to make accommodations for COVID, how year 1 might look different from years 2 and 3. So it gets much more into those kinds of details. And then the interview as well gives us an opportunity to ask more questions that really help us to kind of understand what would be the strengths and challenges for this particular organization for being able to manage a city contract. Because some of the things we really needed to be able to see is within the administrative expenses, small organizations can cover logistical things that they may not have yet, like someone to help with invoicing or evaluation, in specific ways. But they're all going to have different strengths and challenges with the process, and we want to be able to build their capacity. And so we'll get to know a lot more about what that's going to take to support that organization through the interviews as well as the step 2 application.
Okay, thank you.
Yeah, my question was a little bit around what you were mentioning, Erica, because I know that by definition, because these are smaller organizations, as they move into step 2, just having just the understanding that they're in this COVID environment and their resources are probably stretched a little thin. And so their ability to manage a grant like this. So it sounds like you are kind of making an allowance for that, or allowances for that, because they are small.
I'm really committed to being able to, once we get them through this process, to being able to coach and provide technical assistance. I feel like one of the things that we've said is it's really important to help them build capacity. So throughout this whole process, even those who don't get all the way, I've tried to build ways that it's like a learning experience for the smaller organizations at every step. And so I know there are things that are totally non-negotiables. Those are part of how government works. But my plan is to help walk people through that. And once they have done that, then they'll be better placed to apply for large grants down the line or other funding sources as well. So they'll be able to grow what they do for these really marginalized communities in need.
Yeah, I think all these questions are building upon one another. I appreciate you took a pause with some of the applicants that were from smaller organizations that had barriers. And I really appreciate hearing that. And then it makes sense why some of them were lifted into the round 2, if you will. And I also was taken with your comments about capacity building. So my question is about how my experience on the other side, which is what I'm used to, is that many times government grants especially put a lot of time on the recipients. And you can sometimes feel like you're spending a lot of your time administering the grant as opposed to getting the money to your frontline workers. And the smaller organizations, as you pointed out, would struggle with that, and no matter what. So are we did I hear you right that when you say technical assistance, is that something that would be provided after the receipt of the award as well? And are we accounting for that? And that also comes from a lived experience of the second question, which is what percentage of the grant, is there a limit on how big a grant can be compared to the size of the organization? I've worked in places where you put yourself into debt because you took a grant too big and you didn't have the staffing to pull it off, and then you were shamed. And so it's all from lived experience. I'm trying to ask these questions. Yeah.
Yes, the limit is the same as it is for the larger organizations. So the grant that they're receiving can't be more than 30% of their organizational budget. And in terms of technical assistance, everyone they can have up to 15% of administrative costs built into their grant that can cover a lot of things that they may not have had covered up until this point. And I would be working with them on first just getting through the reporting process.
Yeah.
What are the forms of insurance and how do we do the scope of, work and all of those things. But then also teaching them on how do we do the report and what's the data and what are things that we need to be building in. So, and questions about evaluation and outcome were already asked in step 1 and are built upon in step 2. So one of the things we had heard in the community conversations was that they didn't want a huge opportunity cost in step 1. Because as you see, we eliminated 19 organizations. So they didn't want to have to put a ton of time into the first part. But step 2 does mean they're going to have to do some really deep thinking about how they're going to actually implement this grant and work with, if they're funded, they'll be working with me directly on that.
So the wall is down where you can help them and work with them to help build their capacity. And then maybe it's a comment, hoping that sustains itself if in fact they're granted. Because when we look at equity, diversity, and inclusion, it seems like that's always a barrier, is that inclusion part, and having the grantor help provide that technical assistance once in fact they receive the award.
Yes, and we've been asking about technical assistance at every step. And so I've kind of collected all this information at every step about what kinds of technical assistance people need, and have been sort of putting it into 3 categories. Okay, this is what I can do, or what we can do as PCL. Here is something that might be available within the city or the county, a resource that I know about, or other places. Here's another place you can get it, and things that can be built into your budget. So what can I do? What can be built into your budget so you can find someone and pay for it? And what can I give you a resource on where to find it somewhere else?
And then a new person question. Is 15%, Lisa, you probably know this off the top of your head, is that pretty much standard practice in terms of admin support?
We follow the county on that. So the county for their human service contracts does 15%. And, I basically, from doing the reading around, nobody's administrative cost is less than 15% to deliver human services, particularly. There are other organizations that are not doing that don't have the level of staffing it takes to deliver human services. So usually I would say most of the literature has the true cost at 15 to 21%, 22% around there.
Yeah.
So some people are still having to, essentially add their own fundraised resources to help support that.
And my comment, my question is not about it being lower, that's for sure. Because again, my experience is that, the profit sector certainly has at least 50% admin on their organizations. And it's always been a surprising or confusing to me why in the nonprofit charity sector, we're supposed to suffer with running things at 15%. And then the word admin gets portrayed to the public like it's a dirty word. So maybe a better word, because in fact, admin scrutiny is part of operational excellence. And so I'm happy to hear that it's no lower than that. And I think as we do inclusion and we in capacity building, I think we have to really keep an eye on that. So
That's great to hear.
Yeah.
Can I add one more thing that I was thinking of?
Please.
So we know that as we get through this process, we're going to determine, we have to eliminate a few more programs anyway, but we may determine that there are some that we would really like to fund that just aren't ready. So my plan is for those that are just not ready, that we determine are not able to manage what is required to manage a city grant at this time, that I would meet with them later and give them some feedback and things that they need to work on so that in future rounds, they could come back and try again. Because I do want people to be able to learn from their experience again of okay, we couldn't do this, but once we solidify our contract with our fiscal sponsor or we work on these specific things, then we'll be better placed to be able to apply for these types of grants in the future.
Any other questions from my colleagues? We're doing really well on time. It seems to be the meat of the agenda, right, Lisa? Yeah. I have one more, and it might be a new person question again. I'm going to try to get by with that for a while. So it says small grants, but it doesn't mean all these organizations are small. Some of them we know aren't. At least that's what at glance optics. So my question is, can they also apply for whatever the regular cycle is?
At this point, the regular cycle is closed for now until we just completed that round. So they can't do that right now. The total budget, organizational budget that they could have is 1 million. So we do have some that are at the higher end, as well as some that are at the far lower end. But they can be anywhere in that range.
Okay.
The small grant itself, the grants again are between 10,000 and 60,000. For the large grants, Lisa, it starts at 65,000 for the large grants. Yeah, it starts at 65 that they could apply for. So, and both small and large have that 30% cap that it can't be more than 30%.
And that's in actual awards. So in a fiscal year, if you have both grants, but they total more than 30%, that would be a conversation. Okay.
Yeah, and they can't apply. There are some organizations that did apply for large grants, but they were not awarded it. So if they have received it in the past, the large grants, they can't receive the small grants.
Got it.
And just to be clear, when that 30%, we are looking at all of their total, all of the grants they request or get from PCL. Does that make sense?
Yes, it does.
So,
I was thinking that.
Okay.
Yeah. Okay. Any other questions? Erica, did you get what you needed?
Then now I need you to vote and approve on the step 2 materials and process. And then I'll get what I need.
Okay.
So moved.
Thank you. Who just said that?
Stacey.
All right. Second?
Second.
All right. Thank you, Commissioner Vega-Peterson. So all those in favor, please say aye.
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 All right.
Aye.
We're good to go. Thank you, Erica, for your presentation. Now we're moving on. We're going to hear from the Communication Outreach Coordinator. That's John Coughlin. Hey, John, are you on there today?
Hi there. Yes. Hello. I'm just going to
highlight the new Levy grantees spotlighted recently in social media, correct?
That's right.
All right.
Just sharing my screen here. Yeah, so recently the City Council approved 68 million in Levy community investments. So we produced a series of social posts just to introduce people to a few of our new community partners. First up here is Oregon Mesa, is an after-school program of Portland State University. that enables students from underrepresented backgrounds to gain math, engineering, social skills, and through hands-on real-world invention education. And so this is Tong Zan, Executive Director of Oregon Mesa, and Tong said, Children's Levy funding will allow us to expand our programming into even more schools in North and Northeast Portland. Next up, we have Abuela Mama EO is a culturally specific education program to reduce the impact of food and health inequities. In response to the COVID-19 pandemic, Familias en Acción has created a network of food promotories to support Latino families experiencing economic stress, gain access to food resources such as SNAP and WIC, food banks, food pantries, and other local assistance. This is Rebecca Marquez, Nutrition and Food Equity Program Manager. Rebecca said, Levy funding will allow us to pay our network of food promotories to increase food security in Latino homes during the pandemic. Next up is the Contingents Know Me Now program, aims to reduce prison return rates by building family-centric support systems in prisons, homes, and neighborhoods that ensure healthy reunification between families impacted by incarceration. This is Anthony Jordan, the president of the Contingent. He said, Portland Children's Levy has invested in kids and parents, and we're all in to make sure reunification is possible as moms and dads transition home. Next up, Oregon Community Health Workers Association employs community education workers to partner with parents to address the barriers that families are facing, such as housing, unemployment, language barriers, and domestic violence. Shaniqua Finney is the Community Programs Director. She says that the Portland Children's Levy has made it possible for us to continue the Community Education Worker Program. This culturally specific program has changed the lives of many families in ways one could not imagine. Next, the Black Parent Initiative will support its culturally specific approach to prenatal, doula, lactation, and home visiting services for parents. Bahia Overton, the Executive Director of BPI, says the Portland Children's Levy assists us in ensuring that African American, and African American multiracial families thrive. Finally, the Latino Network's Padrinos Portland mentoring program is based on the Latin tradition of Compadrazo, a social support program in which a close family friend is chosen by family members to guide their youth through their social and emotional growth. This is Shamina Ospina Todd, Community Stability and Support Services Director. She says Levy funding will help the Latino Network to round up our services for violence prevention and to give violence-impacted families the necessary tools to be involved in the prevention, early intervention, and probation of youth. That is it. Thank you.
Okay. Thank you, John. That was wonderful. I think that was just a real FYI overview. I just have one question. How are our metrics in social media? Like, how many friends do we have? Like, just a thumbnail.
I think we're at around 9,000 followers on Facebook. I don't have the exact numbers in front of me, but I can send the report to you if that's helpful. But I think we're about 700 on Instagram, and I want to say 2,000 on Twitter. So it's been slowly growing over the 3 years I've been here so far. I mean, we do reach hundreds of thousands of Portlanders every quarter. We do quarterly reports, so the reach and engagement is really grown over the last couple of years.
Yeah.
Incredibly.
Have you found that it spiked during COVID?
I don't know. I couldn't say that there's been a spike in terms of engagement on COVID or during the COVID crisis. No.
Okay. All right. Thank you so much. Where are we? Oh, it's on the backside. So now we're moving on, and we are going to have the Assistant Director, Meg McElroy. You're going to review data and results that were just completed about the 1920 funding, correct?
I am. Thank you. I'm going to share my screen. Let me know if you can't see it. Turning on the start from the beginning here. Let's see if I can turn off the presenter view. How's that look, everybody? Can you see the slides? Great. So we're going to take what kind of move and transition from John, featuring a newly funded program in each of the Levy 6 program areas to kind of the more 30,000 foot view of what just happened in our last funding round. This will be helpful, I think, Dan, to kind of orient you a little bit more to what we just went through, but it sounds like also you've been paying attention to some of the changes. So I'm going to kind of review what led up to those changes, and then some of the preliminary data that we've looked at to kind of understand whether or not some of the changes that we made are heading in the direction that they advised us to go. So this is a preliminary report. We have not, on account of the time right now, gone into great depth into all the data that we have available to us, but we've got some rich data and we're looking forward to digging deeper into it. So I'm going to look at some data that came from all the applications that we received, as well as a survey that we did with the folks who reviewed and scored these applications. And we also surveyed applicants themselves. And what we're trying to kind of start to look at is whether the process changes that we made that were the result of recommendations from our community engagement and grant making improvement reports that were undertaken in advance of our grant making, that our changes really start to implement what they recommended. So in 2018, in advance of this 2019-20 grant making process, we did a pretty significant planning effort that included staff looking at local data on children's needs and outcomes. It included a 9-month community engagement process in which we contracted out with Empress Rules Equity Consulting. She and her team spoke to over 85 people in focus groups and surveyed over 500 different people, 400 of which were families and participants in services, and 100 of those folks were service providers. We contracted with Portland State University's Center for Improvement of Child and Family Services to look at our grant making process. They went through materials, allocation committee videos, past applicants, applications. They talked to funded and unfunded past applicants. And collectively, those two big planning efforts led to recommendations around ways to increase equity and transparency in our process. In community engagement, the recommendations focused on wanting to see increased attention to and support for culturally relevant and culturally specific services where the staff reflect the cultural background and the languages spoken of the children and families served. The leaders of color are at the executive level in the organizations and programs funded, and that organizations are really looking at ways of including families in the planning of the services. And PSU's report had over 30 different recommendations on ways that we ought to rethink and revise our equity and transparency processes. And we took them up on many of those recommendations. And so we redesigned our request for investment, which is our application questions and scoring criteria, to really focus more on different aspects of organizational commitment and practices for equity, diversity, and inclusion. We tried to amplify our transparency throughout the entire application process. We had an FAQ on our website. We offered a weekly question and answer email digest to applicants in which every question that they asked us and that we answered went out to every applicant for their own use. We tried to provide frequent updates on our grant application process and timeline using our social media and our website and email. We did an extensive months-long community volunteer reviewer outreach effort. We screened reviewers against criteria around their experience in our program areas, around their experience with equity, diversity, and inclusion practices in human services organizations. We had trainings and check-in for those folks. We provided stipends. And then we also revamped our entire application testimony process. Rather than having the testimony take place at the public meeting, we offered applicants the chance to provide their testimony in writing and in video. And in a great coincidence. We had put that all in motion before the COVID pandemic put us all indoors. So it turned out really to be a helpful way in which all of the applicants could get additional messages to our allocation committee. So now, let me back up. If anyone has questions as I'm going through this, feel free to chime in. I'm happy to have you ask as we go. We received over 116 applications requesting over $114 million in funding over 3 years. And as John, I think, noted earlier, we funded 85 total grants. So this table kind of walks you through the types of grants in a couple of different categories or ways that we've categorized them, which are programs that were receiving levy funding in the past but did not receive additional funding for expansion, programs that received continued levy funding and also received funding for expansion, particularly to serve populations that were identified as high priority in local data and community engagement. And then 22 new programs, 10 of which are being operated by organizations completely new to having levy grants. And some of those were featured in the slides that John just shared. And 12 of those programs are new programs at agencies that were receiving levy money before, but are now getting levy money to do new services. In advance of the grant making process, the allocation committee made a preliminary sort of planned allocation of how much of the total resources by percent would go to the Levy's 6 program areas. And part of those were based on sort of where we were funding before and what past applicant demand had been in those program areas. And then the committee, as they made their funding decisions this past spring, they tweaked those allocations slightly, and that variance is largely due to the number of applications that were received in the program area, the quality of the applications, and the priority populations that were proposed for service in those program areas. So in this slide, you can see for each of our program areas kind of where the allocation committee intended to allocate, what ultimately happened, and you can see that in the context of how much money was requested in total by the applicants in each program area, and then how much was granted in each program area. And I'll leave that one up for a minute just so people can kind of look at it.
Thanks.
I should also add that we put together a 5-page report that covers this information as well. We'll be sure to get it up on our website for anyone who's interested.
I have a question. This is really helpful to stare at for a while. I'm impressed with how your final allocation percentages were really similar to what was visioned. There is a bigger delta with some, like say foster care probably sticks out the most.
Yes.
Can you speak to that? Is there a concern that there was such a gap on foster care?
Sure.
I'm not reading it right.
What's that? No, I think you are reading it right.
Well, I thought that the total requested funds, no, I'm totally not reading right, to be honest with you. So I think the plan, the vision was a certain percentage, right? And that was 10.8, and you actually allocated 12.5.
Correct.
My little brain went and decided that the total funds requested were similar to the visioning part, but that's not what happened. That was what they asked for.
Right, exactly. So we had...
It's totally based on nothing that I'm now asking you. So, but you can tell me if you have some insights into that gap. That would be great to listen to.
I just want to make sure I understand the gap that you're asking about. So there were the applicants in that category, and I don't have the number of applications that we received in that category in front of me. But of the total applicants, they asked for over 3 years, over $26 million. And the allocation committee did end up allocating to that category slightly more money than they had originally planned to based on sort of requests there. So it ended up being 12.5% of our total allocations, but they did not end up, let's see, how do I phrase it, like straying dramatically, so to speak, from the original intended allocations there. And again, it comes down to sort of what the proposals asked for money to do and how well they scored. So I think, and if I remember correctly, that in that program area, several of the services proposed were pretty expensive for the number of children that they were planning to serve. And so I think that reviewers' scores and we as staff also provide recommendations to the committee using scores and other criteria to help them think about their decision making. But the costs of several of those services, I think, just did not kind of rise to the level of funding those over some of the services proposed in other program areas. Does that answer the question?
Yeah, and of course it just makes you think about more questions, like what is the hunch on why there would be such a big gap there? And I know my colleague from the county might have a lot more insight into the world of foster care. But anyway, it does stick out, and I'm glad we're having a little bit of dialogue about it.
It's a good question. And this is the kind of thing where it's like, oh, now that you've raised this, we can delve deeper into the data and kind of see what more is underneath there. So when we come back with a larger report, this is what I was saying, this is kind of preliminary.
Yeah.
But that's a good question to earmark for a deeper look.
Yeah, I have no idea what that could mean.
I mean, I could say another thing. Oops, sorry. Sorry, go ahead, Dan. I didn't hear what you said.
I just wondered if Jessica wanted to weigh in at all.
I think just to provide context, when we were talking about the planned allocation, we really looked at percentages, and we did that work prior to actually knowing how many applications we were going to be getting in each category. So I remember Mitch actually really advocated for having a larger allotment to foster care when we were talking about how we were going to divide things up. And then I think subsequently, when all of the grants came in and we saw exactly how much we had in the different program areas, we realized like there were just a large number of asks in foster care this year. And so then that led to even a greater allocation, I think, than was even originally planned, even after the advocacy that Mitch did to increase that allotment. So, historically, I don't know how the ask around foster care compared to like past funding cycles, since this was my first time going through the whole process, but I do remember that specifically was, looked at. And I think that, again, I think it was some of the planned allocations percentage were based on historically how we funded and where the number of grant requests have come in. And, staff you can add on to that, but that's kind of how it went for this past cycle. And
Commissioner, isn't it true that I know the public sometimes doesn't know this, and maybe it's improved in government, but there's like this cutoff, right, at age 18 for foster care?
Yes, that's correct. And so filling that gap.
Children knows just how bizarre that is, since we, when we take care of our children, they need a lot of support into their 20s usually. And so I just wonder if my hunch is there could be some connectivity to that. I don't know. And do we get outside of the box on this one? Will we fund foster care beyond the age of 18? Meg's giving me a wonderful nod.
Yes, we do. Up to age 24, if I'm not mistaken.
That made me really happy to hear. All right.
Yep.
Anyway, thanks for digging into that a little bit, because it could be just about the gap that what government doesn't provide, the need in foster care. And so it's a hunch. Again, I'm just looking at data and trying to figure out if there's a hunch there or not. So.
Understood. If I'm not mistaken, as I look at these numbers, the other gap that's pretty big is in the mentoring program area.
Yeah, that's exactly.
So in advance of this entire grant making round, as staff, we provided for organizations that were interested in applying data from the last time we did a big grant making round, which is in 2014, which was the number of applications we received in the program area and the total amount that was requested and the total that was allocated or granted in those program areas. And at that period in time, we had many fewer foster care and mentoring applications. And so we weren't sure if part of what happened was that folks sort of saw an opportunity for, or a door open there, sort of if you had fewer last time and the competition was less, maybe we have better chances if we apply this time. And that could have driven sort of some of the numbers of requests here.
I would also like to add, as you all know, I'm working really hard to get a lot more money for early childhood with Preschool for All. And so, my hope and vision is that if that passes in November, then we can actually help, with Portland Children's Levy working in partnership to also then be able to provide more funding for some of these areas if we have an influx of dollars for early childhood, to really, because as we know, the need across all these areas is so great.
Thank you, Commissioner.
Well said. Thank you for adding that.
Yeah.
Tracy, do you want to add anything around mentoring since you hang out in that space? Not putting you on the spot, sorry.
So it's no problem. So this is my first round. So in terms of, comparing the numbers of applicants, I'm not as familiar with that, but certainly I think that it's just we have a lot of data, in relationship to mentoring, and we know that it works. So I'm not surprised that there's more folks wanting to enter that space. As we know that it really helps with outcomes. I think that's all I would add. It's just the more we do it, the more we know, the more informed we are.
Thank you.
Yeah.
I'll move on to the next slide unless anyone has any other questions on this one. Okay. So for this one, in part of the changes that we made in the request for investment, the RFI application, the questions that we ask of applicants and the information they provide to us, PSU, Portland State University recommended that we ask more about staff demographics to make sure, again, that we're understanding better who's providing services to the children and families served. And we crunched this data after applications came in. So this wasn't part of the decision-making process, sort of at a 30,000 foot level. And so what we found was, of the 44 organizations that received services in this process, 50% of the funding that we granted is going to 19 organizations where the majority of the staff at that organization identify as Black, Indigenous, people of color. And about 41% is going to 22 organizations with a majority white staff. And then there were 3 applicants whose data was not sufficient, where over half of their staff, they were missing data on the race, ethnicity, identity of their staff. So we weren't really able to crunch it entirely. And then with the new grants in particular, so one of the things that's in the report that you all were provided in advance of this meeting that we'll put up on our website, for the $11 million that went exclusively to the 22 new grants funded, 75% of that money went to organizations with a majority BIPOC staff.
I have a question, Meg. So did you all look at all at the boards of the different organizations? And then also, did you take into consideration at all in those organizations the leadership and what the demographics looked on the leadership level?
Such a good question. So we didn't ask for just the CEO or the executive director's demographics in the application. So we don't have those data. We're talking about how we can look at those data as part of our annual reporting from grantees going forward. So we're kind of seeing this as baseline. And so we're seeing where we have holes in our data. And then we did ask applicants for the race, ethnicity, demographics of their board members. We just didn't have time to crunch it prior to this presentation. So we will be able to put that together for you. But just in terms of data entry and putting it all together and aggregating it, it just didn't get done before this meeting.
Great, thank you.
Yeah. Okay, so as I mentioned earlier, we recruited reviewers to score, read and score our applications. We recruited 65 people, and we wanted to understand kind of like whether and how scores made a difference in the funding of these organizations. So we as a staff prioritized as part of our recommendations the scores that were given, and then other criteria. But when we looked at after the fact, kind of crunched the data, we see that the average score of applications that received funding in this process is about 10 points higher in total, and then also in the individual sections that people generated for their applications than unfunded applications. So the application had 3 sections, one that looked at an organization's commitment and practices around equity, diversity, and inclusion, one that really looked at the program design and effectiveness, and then one that was on the budget. This table tells you about the total score of the application, which is the reflection of the average of 5 individuals' score on it. and then it looks at the section scores. I didn't provide the budget score here because the budget was a total of 10 points, and the variance there between funded and unfunded applications was less than 1 point. All right, reviewers. We did survey the reviewers that we recruited. So out of the 65 folks that we recruited, 63 of them completed the entire review process, and 54 of those reviewers responded to an anonymous online survey that we sent. In an optional question, we asked them about their race, ethnicity, demographics, and 26 out of our 54 survey respondents identify as Black, Indigenous, people of color, 24 as white, and 2 did not answer that question. In general, our reviewers had a very positive experience, they said, according to their Likert scale questions on the survey, and they provided generally positive feedback across a handful of domains that we asked them about the review experience. 38 of our respondents indicated in a multiple choice Likert scale question areas that need improvement going forward or sort of continued strengthening. They said that the focus on equity, diversity, and inclusion, including the questions and the application, the scoring criteria, could use some strengthening. Unfortunately, their open-ended responses about ideas to do that are kind of contradictory to each other. Some said one thing, some said another. So there might not be a lot there yet for us to work with, but we'll spend more time on those data in the future. But we were pleased to see that overall, all of the reviewers indicated a positive response around their experience. And then applicants, we sent an online survey to 131 individuals whose names were associated with the applications submitted. Only 44 of them responded, and a lower response rate than we would have liked. And because the survey was anonymous, we don't know how many organizations, for example, are represented by those respondents. So we kind of want to caution how we interpret these results. People generally expressed satisfaction with the RFI itself and the question and answer process that staff used to support applicants, and our overall staff communication with them throughout the process, including that they received staff's funding recommendations well in advance of providing testimony to the committee and well in advance of the committee's decisions. And they also received the completed score sheets from all the reviewers. They expressed dissatisfaction with the sort of process that was used in the decision-making meetings, as well as rationale used by the committee. And they also expressed dissatisfaction with understanding the rationale that we as a staff provided for our funding recommendations. So there's certainly work where we can do better there. And then sort of overall, like I said, when I started this, we started to dig into these data to understand, are we headed in the right direction? Oh, yeah, go ahead.
Yeah.
Sorry.
Go back, please.
Yeah.
So it was anonymous. I get that part, but did you ask them if they received an award or if not?
We didn't. We thought about it, but we didn't do it because we didn't want people who didn't get it to feel like, we didn't want either way. We didn't want them to feel like they couldn't be honest. You can tell by some of the open-ended responses whether or not the applicant received funding just based on the comments that they made. But we felt like that was going to ask that question was going to limit what people said. So.
Yeah, I mean, I think it's great it was anonymous. And I'm sure you had a good conversation about if, in fact, you should include the question if they received the award or not.
I think what the, oops, sorry, go ahead.
I'll stop there. I'm glad I think it's an open dialogue, don't you?
Yes. I think
people are careful to be, I think once you're awarded money, you're less likely perhaps to be critically honest. And sometimes I've noticed that. And so, yeah. And I think it's confusing why only 44 of 131. And I know that you expressed that was some disappointment with that.
Yeah. You know, one thing I will say is that when we hired PSU prior to this process to go back to our 2014 process and talk to past applicants who were funded and unfunded, I think that probably yielded that was a better approach to sort of feedback. I think it's unfortunate we waited almost 5 years after the fact to consult with those folks on that experience, because, you know, your time removes sort of your memory of it. But I think already right now, I would like, if we are able to figure out how to revisit gathering feedback from applicants more quickly after this process, to be able to employ, again, some kind of more focus group or interview-based approach to probe really like the differences between not receiving funding and receiving funding and your experience of it.
Thank you.
Yep. So in conclusion, like I said, from this preliminary look at data, we do feel like the data suggests the changes that we made are kind of moving us in the right direction. We're certainly feeling positive about funds increasingly moving to organizations with staff that reflect the demographics of the youth and family served. And we felt good about reviewers feeling like it was a positive experience. And we're looking forward to kind of digging a little bit further into those data. And then I think that once the small grants process is complete, we'll have a lot more to reflect on, both from that process and our large process, to think about what our opportunities are for continuing to push our grant making toward increased equity and transparency going forward. And I'm happy to answer any other questions folks have.
Thank you, Meg.
Sure.
Any questions? And Felicia, you're back. Okay. And I saw your notes that you've had internet challenges.
Yeah, I was just telling them my internet is great when it's all of you guys up here. It's just that when we go to the presentations, I have to turn my camera off so I can hear. It's the most bizarre thing.
Yeah,
I'm glad you could still hear it.
Yeah, but darn, you can't visually. Okay, can't engage. Any other questions from the colleagues? Okay, I see none. All right. So Meg, thank you very much. That was wonderful. Our last agenda item, we're going to turn it over to you, Lisa Pellegrino, and you'll give an overview on how the Levy partners have adapted their programs and delivery during this time of COVID. And everything else. And you know you're muted probably. Maybe I'm having.
Sorry about that. No. It was all me. I'm just trying to get it to what I wanted. There we go. Okay. Sorry, I just can get my screen to only show you the slide as opposed to showing you my view. Thanks, Dan, for turning over. I want to sort of pick up the story that we've been telling today at the point where staff are talking to all of the grantees that most of this committee made decisions to fund in the last grant round. So we've been busy over the summer having conversations with everybody, and we've been trying to take to heart. So Dan, I know you weren't here at that point, but the committee counseled us as we went forward in this round, because of course this funding round was happening while COVID was exploding, to be as flexible as possible with people, for particularly around this first year of implementation, because many people are imagining, we're proposing doing different kinds of expansions and different kinds of services, some of which were going to be much more difficult, or in some cases perhaps impossible to do during the pandemic. So we've kind of gone into all of these talks with grantees with trying to be flexible. So what we've essentially been doing has been negotiating an agreement that allows for, here's what you will do when there is no pandemic, and you can actually hopefully do what you anticipated doing, in at least in some similar fashion. And then what are the set of services? What kinds of things are you going to stop doing? What kind of things are you going to do differently? And what kind of things might you add to the services that you're offering during this pandemic time? So I wanted to kind of collect, we've had maybe between 80 and 90% of those 85 grantees that we've been talking about, conversations with about that percentage of them thus far. And I wanted to kind of sum up where we're at. So that mostly also because there's a lot of policymakers and folks who are working at various levels, they can kind of hear how community is adapting, or I should say how community organizations are trying to meet the needs of community in this unique time. Of course, this was all gathered before fires hit. So there may be yet more to tell about that story, but I'll just review quickly some of the kind of main categories of modifications that people have made. So nearly all grantees that we are talking to are moving to virtual service delivery. So that's not a surprise to anybody, I'm sure, but particularly around things like home visiting, case management services, mentoring services, individual tutoring, academic support services, and in many cases for group activities and classes too. People are using all different kinds of platforms and finding ways to connect with people virtually. This is this is easiest to do with folks that you've already had relationships with. So that's one, for folks, for organizations and programs that have people enrolled in services already, it's much easier to pivot to a virtual service delivery. It's a little bit tougher in situations where people have to recruit new people to come into a program. So that's kind of what I've been hearing on that front with all program areas. With the exception of hunger relief. So in hunger relief, you've got a couple of different types of services. People are distributing food, which obviously is key and very important, and obviously still going on in the community during COVID. There is also a portion of hunger relief services in those grants that are, to deliver classes and education and group activities and cooking and demonstrations and different types of activities related to food that are more really don't translate into a virtual or don't translate fully into a virtual arena. Some can be, some less so. Cooking classes for kids, for instance, that's more of a challenge. People are working on figuring out how to do that virtually, including delivering home kits with recipes, and then kids tune in for the instruction and do it at home. So there's kind of a really no end to the ingenuity that people have thought of in trying to keep things going. The other thing that I think has changed is the types of services that many people have risen to the challenge to be able to offer to support families and meet them where they are. So there's lots of different types of services that fall into that category. So you've got lots of programs that are doing home deliveries of needed items, and that's everything from food or medicine or other types of things to participate in classes or extracurricular type of activities for kids. Arranging transportation for people who need to get places, using or doing different kinds of assistance with technological needs. And I would say that's probably the biggest bucket that we've seen added to service delivery. So people are helping from everything from finding devices if people don't have devices to connect to the internet, helping to find and access low-cost internet service has been huge. There's been a lot of problem solving by community-based agencies around that. A lot of support for kids trying to do their distance learning and experiencing various kinds of technological difficulties in that. So a lot of CBOs have found themselves turned into technical support and really gained a lot of experience in providing technical support to people in dealing with just the technological end of distance learning. Then also a lot of support to kids. I mean, a number of people have talked about doing more one-on-one support because kids are in these digital classrooms and are sometimes craving more one-on-one connection. And that goes both for mentoring and after-school types of programs. That some programs have found themselves doing more of that and a little bit less of group. There's a little bit of group Zoom fatigue going on out there, group mobile platform of your choice fatigue going on out there. So a number of people have spoken to that as well. And then I would say the other major pivot in hunger relief has been typically all of the programs that are doing emergency food relief offer shopping style options to families so they can come and choose what they want from what's available amongst donations and purchase produce that the people are giving out or purchase food in general. And that has really ceased at this point due to COVID and trying to make sure that we can maintain distance and deal with all the staffing that are staffing different kinds of emergency food drop-offs. So people, like I said, are doing home delivery. That's one of the solutions to that. The other solution has been various kinds of pickups, and they're mostly prepared boxes or bags of food. So people can have no contact drive-up pickups of various kinds. So that's been the other significant adaptation in hunger relief. People are also, of course, not surprisingly, talking about a lot of additional need in hunger relief, and people are scrambling. And also are some other resources that have come on the scene. The EBT cards that allow people to access lunches, school meals of various kinds, and also the home delivery of summer foods that USDA put out. A number of people have been able to access that funding. So there's been some additional resources coming into the food arena at the federal level, which has helped offset some of the increased need that almost every hunger relief grantee we have has told me about. So that's not surprising, and I'm not sure I'm not telling you anything you don't know with that. The only other thing I will say that, in terms of talking about amount of service that can be offered, as I mentioned above, enrollment of new clients and families is significantly impacted by emergency conditions. And for certain kinds of programs, more so. And I would say for after school activity-based programs, that's probably the highest level of impact that I've seen so far. And people are still very much in the we're figuring it out stage. People are working with the SUN system, and maybe Commissioner Peterson has an even later update about that. But I know SUN is really trying to help all the partner organizations that it normally helps to enroll kids, and so that kids will have activities to do besides school and have other ways to engage and find support that they need, social emotional support in difficult times, as well as academic support to try to get their work done. And school staff as well is trying to pave the way for organizations who are partners and normally would come into buildings to be able to use their platforms to engage students remotely. So that's the one area that is still, I think, very much in evolution, and no firm answers yet. So I've got people in different spaces with that. As I said before, folks delivering relationships, like say, for instance, SEI, delivering relationship-based services to kids who are already enrolled. They've been engaging their kids virtually and very much in touch with them, and they don't have to go out and recruit new people to come in, are in a different space than, say, an activity-based program that typically offers gardening education at a school, something like that. So those are the kind of different places that people are at. And hopefully I've given you at least the 30,000-foot view of what we're hearing from grantees at this point. I'm happy to have any questions or any comments from folks.
Yeah, anyone have any questions? I have one, or it's something that keeps me up a little bit at night, and that is when interfacing with the schools, you always would learn about how the teachers and the counselors are such a reservoir of insight into what's going on at home. And so I'm going to bring up something that we can reflect on and think about as we go forward. But it's the concern about basically domestic violence and child abuse that's going unreported because of the isolation that we're in. And did that come up at all as a concern during COVID? On any insight you have about that, and then maybe obviously this is a big heavy topic that we can dig into more as we look at going forward with funding for the future. But anyway, that's just something that over the last 6 months I probably thought about the most, and it's sad. So.
Yeah, I mean, that has absolutely come up. And unfortunately, Lisa Hansel, our grant manager for foster care and for child abuse prevention and intervention programs, is not here today. She's out of town and wasn't able to make it, but she would have the most insight. And I'd be happy to kind of give you a little bit more specifics about that because I'm not talking to those grantees directly. I can't give you some good examples, but I know absolutely that's been the case. And there's a lot of, and that has even shown up in some of my conversations with after school grantees in particular. And Meg, I don't know about you with mentoring, whether that's something, I mean, organizations are definitely aware of it and focused on it. It's hard in this situation sometimes to be able to change people's circumstances easily.
I also, on food delivery, so I know you mentioned that some of the options were to pick up, and I just wondered if you had any insight if that's one option of many, because I know that for many families, and now especially with the wildfires, that the pickup option isn't necessarily safe even outside of the social distancing considerations. Folks just may not feel comfortable moving about in this environment. So is that an option?
Yeah, I would say it's an option with some providers that have been able to make the space for that. So it sometimes comes down to agency staff, and can they deploy people who can go out and make deliveries?
Right.
There are some programs that we specifically funded because they make deliveries. So for instance, the Meals on Wheels program that does delivered food, that does both bulk foods and meals. So that's a big, and they are imagining a huge ramp up in services for next year. So like probably 1.5 times what their normal delivery would be. And others, like for instance, POIC that just was funded, they make provision. So normally they'd be offering pantries in their schools, and because no one's in their schools, they are doing a pickup option, but for anyone who needs it, are offering delivery services. So they are making that available. So basically people are doing it. It's kind of, kind of feeling into what the family situation is and what the barriers might be. And making sure that the agency has capacity to do it. So I think people are striving to meet that. I can't say that every person who needs it has it, though.
Okay, great. Thank you.
I appreciate that, Tracy. I have a little story on that. Maybe y'all know this, but Hood to Coast, obviously they did have their relay this August. And so they repurposed themselves to work with Sunshine Delivery. So they are good at logistics, right? So they repurposed themselves to work with the food delivery system at the Sunshine Division. And so most of their employees are still employed, but they're working with Sunshine Division to remove themselves from what was a pickup system to now a delivery system. So that's one innovative partnership that just was able to turn around quickly. And so we're looking for stories like that, right?
Yeah, thank you for sharing that. That's awesome.
Yeah, that's great. I read about that. That was awesome.
Yeah. Any other questions, insights? Okay, I just want to thank you, Lisa, for that presentation. And I just want to say, this is my first meeting, and it was a great meeting for me. I really appreciated the presentations, working with my new colleagues who I've had relationships with in the past, but now I get to be at the same table with them. And this is a really tough time. So I keep, in your presentation, I know was the end, but it probably has my brain doing the most somersaults about how we're moving forward. Because I don't think any of us can go back to how we were. And what are we learning at this time that we can take forward? And then how can we challenge ourselves with the innovation that you were mentioning and the creativity? How can we keep leaning into that? And no one's ever been here before. And it's just fascinating to be in a meeting like this when you're thinking of those that are so marginalized and need so much help right now. And anyway, appreciate the staff reports today and the dialogue. So that will conclude our meeting. And I'm really grateful to be here. I'm proud of Portland and Multnomah County on how we work together, and we are nimble and innovative. And we just got to keep pushing ourselves to keep doing that, because I know I'm privileged here in my kitchen, and so many and with food in it. And, we just talked about those that don't have such privilege. So it's great to be here. And we have a meeting. When's our next meeting, Lisa?
The date has not been set yet, but we'll be in touch shortly to get that scheduled to be in likely November.
And I thank for you all for your grace. I have one staff member, and I hope in a few weeks I'll have a full team, but it's just what it is. Anyway, great to be here, and the meeting's now concluded, correct?
Yes.
All
Thank
right.
you. And thanks so much to the grantees who might be watching.
Yep. Thank you all very much.
Of course, that's why we're here. Yeah. Good point.